This medication, called Mononine Kit, is used to prevent or control bleeding in people with little or no factor IX, which is a protein in the blood that helps the blood clot and stop bleeding. People with little or no factor IX are at risk for bleeding longer after an injury or surgery, or for sudden bleeding in the joints or muscles without an obvious cause. It should not be used to reverse the effects of blood thinners like warfarin. This medication is not used to treat other types of factor deficiencies or problems. If you have any concerns about using this medication, consult your doctor or pharmacist to make sure you are using the right product. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. When using Mononine Kit, it's important to follow your doctor's instructions for the dosage and administration of the medication. The dosage will depend on your medical condition, weight, and how you respond to the treatment. Before using the medication, gently swirl it to mix, but do not shake it. Some forms of the medication need to be completely mixed into the liquid, while others may contain a few small particles in the vial. If you have any questions about using the medication, consult your doctor or pharmacist. If you are administering the medication to yourself at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Additionally, be sure to store and discard the medical supplies safely. The medication in the vial and the supplies should only be used once and should not be reused. If your condition persists or worsens, be sure to inform your doctor. If you experience pain, chills, tingling, flushing, headache, nausea, or vomiting after using Mononine Kit, notify your doctor or pharmacist. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. Contact your doctor immediately if you experience swelling, fast heartbeat, shortness of breath, changes in urine output, swelling of the ankles/feet, or increased bleeding/bruising. Seek medical help right away if you experience chest pain, trouble breathing, or bluish fingers. While rare, it is important to seek medical help if you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not mentioned here, contact your doctor or pharmacist. Before taking Mononine Kit, make sure to inform your doctor or pharmacist if you have any allergies to factor IX products or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor, especially if you have other clotting disorders, heart disease, immune system problems, recent surgery, or liver disease. If you are planning to have surgery, it's essential to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Since this medication is made from human blood, there is a very small chance of getting infections from the medication, such as hepatitis. It's crucial to consult your doctor or pharmacist for more information. If you are pregnant, you should only use this medication if it's clearly needed. It's important to discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Mononine Kit include drugs that help with clotting, such as aminocaproic acid and tranexamic acid. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much Mononine Kit and experiences severe symptoms like fainting or difficulty breathing, it is important to seek medical help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to not share this medication with others. While using this medication, it is important to undergo lab and/or medical tests to monitor factor IX activity. It is important to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of the Mononine Kit as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the Mononine Kit and keep it out of reach of children and pets. Do not dispose of the medication in the toilet or drain unless directed to do so. If the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.